Hi, I'm Ilana Frank. Thank you so much for joining us today at this very important conversation where we're going to be talking about how to better support your children during infertility. So I'm really excited. Today, I have two very special guests with me today. They're going to introduce themselves in a second, but you'll see Marlene on top and Janine on the bottom. Marlene and Janine, they do rhyme. But Janine is my mother, and this is the first time that we're actually doing any sort of panel live conversation together. So we'll see how it goes. Again, I'm Ilana Frank. I'm the CEO and founder of Jewish Fertility Foundation. Like many of us in this space, it's very personal to me. I have 3 children born from fertility treatments. I've been married a little over 11 years, and I thought you get married and you have babies, and it did not exactly go like planned. Luckily, I was living in Israel, a country where socialized medicine and family building is very important, and I was able to take advantage of their socialized medicine, where I was able to have 2 children through IVF, in vitro fertilization, for free. So while I feel very fortunate that my journey there happened, it also didn't come without stress. It was very stressful. It was very hard for my husband and I. And the truth is that my mom didn't even know what was going on, probably for the first 8 or 9 months, until she came to Israel to visit us. And we were taking a vacation, and I desperately needed to get back to the city I lived in order to begin shots and medication. And I didn't even know how to open up and share that with her. And it was really hard. And the truth is that the beginning of my fertility journey, even though it took about 1.5 years, it was hard, but I was able to have 2 children somewhat easily through fertility treatments. But the real journey started after I came back from Israel to America, and I knew that my family wasn't complete, and I had 2 young kids at home. And for 5 years, I struggled badly wanting to have another child. And we went through adoption, and we went through the foster care system. We did many more rounds of treatments, fertility treatments like IUI, and nothing was working. And that's truthfully when I turned from thinking I was the only one in the world going through this to the support of my family. And we'll hear a little bit more today about what that means and how that helped. And not that it was easy, but it definitely felt very different from being closed off in the beginning of my journey. I kind of separate them into 2, to the second half, where when I was going through our adoption process and failed adoptions and failed cycles, I was actually living with my mother at the time. And then finally to where I have a 1-year-old today from receiving a donor embryo. So my mother was probably one of the people who knew everything, even more than my husband, truthfully, and was a supporter and asked a lot of questions and helped explain things. And we'll talk a little bit more about that today. I run an organization called Jewish Fertility Foundation, and we do 3 main things. One is we offer financial assistance, $1,000 to $15,000 grants, fertility treatment grants for IVF, in vitro fertilization. In addition, if you are living in Atlanta and Cincinnati today, you can also receive a 20% discounted rate if you're a grantee of ours, and from the clinics that we work with, in addition to up to $7,500 of interest-free support, financial support. Money is important, but emotional support is also important. We also offer free support groups for anybody regardless of their religious background, as well as our Fertility Buddies program, which is where we match up veterans of infertility with people going through infertility today. And again, everything that we offer in terms of emotional support is meant to be community-based, and it is free of charge. Everything right now happens to be virtual. but face-to-face, once we can do that again, is very important to our organization. And then the last thing we offer are educational trainings. Similar to what we're offering today, we also go into fertility clinics and train doctors, nurses, admin, staff around special needs of Jewish clients. We help people understand better different pathways to parenthood, how you might achieve a family through adoption or surrogacy or embryo donation or straight up IUI, intrauterine inception, like the turkey baster method, or IVF. And we're here to support as well loved ones of people who are experiencing infertility. So again, without further ado, I'm going to turn this over to Marlene to briefly share a little bit about yourself and what brought you together with us today.
Thank you, Alana. So I'm Marlene Sukenik, and I guess I'm wearing two hats today. I am a licensed clinical social worker, and I've been in private practice for many, many years. I've been in Atlanta for about 6 years, so I've been in private practice here for about 6 years. And I've worked with lots of people who have infertility issues. But more importantly, I'm here as a mom because my daughter went through infertility, and I'm very happy to say that I have as of today, 15-month-old granddaughter whose name is Eloise. And we are leaving tomorrow. We are actually driving, not flying. We are driving to New York to go spend a couple of weeks because I haven't seen them since January, thanks to COVID.
Wow.
So went through quite a lot with my daughter. She went through, I think, 3 IUIs. One of them she did become pregnant, but it was not a viable pregnancy. And so she had a DNC. And then on the second IVF, she became pregnant with Eloise. So it was a happy ending, but a very stressful, difficult journey. And my daughter is an attorney, works at a big law firm in New York. And in the midst of all of this, her client at the time was in San Francisco. And so she was traveling back and forth pretty much every week between New York and San Francisco. So sometimes had to get her medications and whatnot in San Francisco. And sometimes there were mess ups with that. And, you know, she'd be walking to the pharmacy and calling me, and I'd have to, you know, calm her down. And it was a journey. So again, I'm happy to say that we have Eloise, but so I'm here probably more as a mom than I am as a therapist, but certainly happy to give some therapeutic advice as well.
Thank you. Thank you. Sounds like you get it. So Mom, Janine, I'm going to turn this over to you to also just tell us a little bit about, obviously I'm your daughter and you have been there, you know, throughout it all, but what else can you share with us about why you're sitting on this panel today?
Okay, I'm Janine Beckerman, and my background is in education, elementary and special ed. I'm here today for 2 reasons. The main reason for now is that I am the grandmother now of 3 grandsons from a mother that was considered infertile. We were sitting in Israel around the pool, and that's how I remember it. And I remember that suddenly Ilana got a little antsy, and I could see that there was something on her mind. And she did come out and give us the information. My mother was there with me, give us the information about her journey. As the potential grandmother of these children, I sat there. I did not respond. I did not know what to say. I didn't know how to ask anything. It was just a new field altogether. As Ilana said, I took this entire journey with her. I researched, I asked, and I felt as if I was able to be a support. However, it was still difficult to think of what would be appropriate to say and what not to say, what to offer and what not to offer, and how to show my support. So that's the reason I'm here today. The other reason that I'm here today is that I had a loss of my own, a third trimester loss of a child. So I feel as if I am on both ends of the discussion here.
Thank you. So we have a whole long list of questions that sometimes intended grandparents have sent us, and also others from children who are currently experiencing infertility. So I'm gonna dive in and go ahead and ask some of these questions. So one that we do get a lot is that my daughter hasn't fully opened up to me. Maybe there's some inkling, but what can I do to show her that I support her and I want the best for her, perhaps without being too overbearing, or like what my mom said, like she just didn't know what to say? What are some things that they can kind of just start with in the conversation? Marlene, you wanna tackle it first?
So, I mean, I think it's really important to first just understand who your daughter is, and what her personality is like. My daughter is somebody who kind of keeps her cards close to her chest. So I respect her privacy, and I didn't, I didn't nudge her. I didn't bug her about things. I think, she opened up to me and she just shared with me, and I just really asked her, what role do you want me to have in this? Is it okay if I ask you how you're doing? Is it okay if I ask you if you have any doctor's appointments coming up? I allowed her to be the lead. I think it's a time when you feel so out of control and so, I think, betrayed by your body, that I think it's just really important for your daughter to feel as though she has some semblance of control.
I think that's helpful. Do you have anything to add, Mom?
I do. You call me Mom, Janine, anything you're comfortable with.
Ooh, thunder.
I feel as if it's most difficult for a daughter to be able to open up to her parents because she knows her parents and she knows they're there unconditionally. However, to a point where she does not want to hurt her parents and put them through unnecessary stress, but she needs them. She would probably welcome time spent alone with her mom or her dad, going out and just doing something like a massage or a coffee. Sometimes it's just a hand on the shoulder or a smile across the room. We need to stay connected with them. And like Marlene said, they need to set the pace. They might be private people or not. However, this is a new realm for a family. And I feel that we can just tiptoe and figure it out with them. And if we do something that's not that doesn't feel good, we can either realize it or be told by our daughter.
I think so. I think that even being open to saying, if this doesn't feel right to you, please just tell me, because it might change along the journey. Infertility is like a roller coaster. So keep in mind that every single month that you're not getting pregnant, right, you kind of just have to hop back on. And it's like, you're excited, you're hopeful, think it's going to work. And then, oh my gosh, maybe I'm doubting and I'm grieving. And then you're just going to start it all over again. So during that process, your feelings might change as well. And so just having somebody to be there to be like you said, Marlene, how can I be there to support you? It might change, but also knowing that the relationship is comfortable enough to be like, okay, that's cool. I understand you're also potentially hormonal and going through stuff. Like, I'm just there with you. I think one thing, Mom, that you did that I remember clearly, I think it was 2 years ago. It was right before Mother's Day. And my sister and sister-in-law had just both, I think, announced their pregnancies, or I knew they were pregnant. And I had one last shot. Like, literally, it was the last shot that I was ever going to try to do any sort of fertility treatments, IVF in my case. It was the last month. It was the last embryo, everything. And I had 2 little kids. Like, not that I shouldn't have felt this way, but I was a wreck. And we were supposed to go to a Mother's Day dinner or brunch or something. And you're like, it's okay. Like, you don't have to come. And it was just, I couldn't go. Like, I physically couldn't go. And the fact that you stood up for me and our family, and sometimes it was hard to explain this to other people who didn't get it, but that meant a lot, just standing up for me and kind of just letting me be with my feelings. So a question we get a lot, and we actually have some great, like a one-pager, what to say, what not to say, to people who are experiencing infertility. But I'd love to hear from you. Are there certain things that, you know, your kids have given you feedback on, what to say, what not to say, while folks are having a hard time getting pregnant? Sure, Janine, why don't you go ahead?
The best things that I think, I'm trying to think back to my loss.
Mm-hmm.
And the less said was better. And short sentences, phrases, and I'll give a couple of examples. And I have found, as in most things in life, if you're concise, you're heard. If you go on longer, oftentimes you're not heard as well or misinterpreted as you go along. I'm sorry this is happening. To me, is profound, and it's the basic to set up the conversational atmosphere. And that I love you, even though your children know that we love them. That's why I said earlier, touch a shoulder, smile. This is a very sensitive time for them and for the grandparents. And we need to be close as possible without being too close. Very difficult. And I would offer distraction, and I remember that being done to me, and I threw it away. I did not take advantage of it because that was who I was. What I would suggest is say to your daughter, let's go out and have a cup of coffee, just the 2 of us. Let's have a massage. Just either give some ideas or ask your daughter what she would like to do. This is the time to be even more nurturing than possible, if that's possible, and they need that.
Go for it.
I think it's really important also. I think everything Janine said is spot on. I think it's important to ask your daughter, do you want to talk or do you want me to just listen? You know, again, allowing her to kind of lead, but not be afraid to ask. I think sometimes, you know, you feel like you're walking on eggshells, you're not sure what to do. And so a very common thing is we all love to avoid at times. And so, but that avoidance oftentimes makes things worse because, you know, I'll have people say to me, you know, nobody even asked me how I was doing. No, I felt like a leper. And so I think it's important to ask and to be specific, you know, what can I do for you specifically today, right now, to be helpful? I think one of the things not to do is talk about somebody else's experience and let your daughter know how so-and-so went through it or what so-and-so did. I would refrain from doing something like that because generally they really don't care what so-and-so did or their experience. They're just going through their own stuff at that point.
I think so. And I think one of the worst things people have said to me are, well, why don't we try this? Or have you tried this? Why don't we just adopt? Why don't you just da 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 da? You should feel so happy that you already have children, 2 children. And then that just makes me feel horrible. Obviously, I loved my kids and I felt grateful, but that didn't stop the feeling from, biologically wanting something that I physically couldn't make happen. I think that those are great. So one of the questions we also get a lot, and this can be a tricky one, especially for some of perhaps the intended great-grandparents. So donor gametes and how future grandparents can become comfortable, if they need to be, with the idea that egg, sperm, or embryo donors may be needed in the process, or that in reality there may be another biological parent to be considered in the future. And I'm not going to go into too much detail about our family for the sake of privacy, but it was interesting. It is interesting about how, about how our family came to be and who's on board with it, who has questions with it when it comes to donor embryos. So what are your thoughts? How do we help educate family members? Because in today's understanding around what is best for a donor conceived child, as we're understanding, is to be as open as possible. So if that's the case, then do we need to be as open with our family? Marlene, I see you nodding.
So, I mean, again, from a therapeutic standpoint, yes, I think people need to be open. I mean, I think research has shown that that is what's best for the child. And I think that's who you need to be thinking about. I mean, again, that's strictly from a therapy standpoint or from a psychological, emotional standpoint. But I mean, I did not go through this personally. I think, Janine, you're probably better to answer this than me at a personal level. But I have gone through this with a good handful or 2 of patients, in terms of donor eggs or donor sperm. Certainly adoption through the years, I have gone through this. So, and I've seen, I've been in practice for many, many years, and I've seen that whole adoption thinking change from one end of the spectrum to totally the other end of the spectrum. So,
right.
But I'm going to turn it over to Janine because I think you can answer that better.
Yeah. People of our generation remember the first test tube baby. And I think that when you hear and learn something that's so profound, it sticks with you and it's difficult to update it and become modernized. And what I would say to grandparents to start with is egg, sperm donations, embryo donations that culminate in a successful pregnancy are your grandchildren. You can see the pregnancy in your daughter-in-law, and as you see her grow and as you see her nurture, feed, take care of this baby afterwards, it is your family. We had 2 IVF, and that there wasn't that issue because it was egg and sperm. When we had the embryo donation, that was said unintentionally, when we had the embryo donation, I think that education might be a good idea, Ilana, to talk at some point, not on this, but to talk about how and what has to transpire for the egg to go first and all of that. When the embryo baby came out, we weren't in the room when that baby was born. The second we saw him, it was ours because we'd gone through the entire process. He has never been anything but the same as his brothers and his cousins. He is our baby. my older grandson from Ilana, Levy, actually said something about he looks like me and he has my nose or something like that. And I forget also, it's not forefront, it's not even on the side. Matan means gift in Hebrew, that is his name. He is a gift to everybody that he sees and everybody that meets him.
So I think it was also a little bit easier for us because we were going for about 1.5 years through the adoption process, and we were very open about it. It didn't work out for us, but like we would have adopted any baby, any race, any background. Like we were open to it, so it wasn't a crazy jump for us. But, you know, we have many clients today at Jewish Fertility Foundation who are still very concerned because, you know, sperm donors are even harder to kind of talk about. It's really embarrassing for men. I don't want to say less embarrassing for women, but the men we speak with are just, it's uncomfortable. And when you have an egg donor, you know, often it's still very private today. So if it's very private and uncomfortable for the child going through, just standing confident and, you know, sharing it with the family, I don't know, it's got to be really hard. And I do think we need more language and education around that as well. Okay, we have time for, let's see, one more question. One of the questions, two more questions. One of the questions that we also really want to help give some real answers and language around is, what do I tell my friends when they're asking about my kids getting pregnant and going through all of this? If my kids are private, like I know I always would be like, okay, this is not for conversation. This is not, you know, I was so private. Also because I was really scared. Like there have been losses, there have been situations that just have not worked out for me. I just did not want to talk about anything. Even when I was finally pregnant, and I remember my sister-in-law and sister were pregnant at the same time, everybody always wanted to like take pictures of our bumps together. And I was just like so nervous and afraid, and people just could not grasp that. But prior to that, what can you say to your friends when you're trying to hold your children's feelings close to your heart and you don't want to share, but you also, you know, they're your friends?
So my experience, interestingly enough, was that my really good friends didn't really ask me anything because I think they were respectful of boundaries, and they knew that if Brittany was pregnant, I would share that news and, you know, and whatnot. It was people that I didn't know very well that maybe would say something to me. So, I mean, the way I handled it, because again, I know my daughter well enough, and I know she would not have wanted me to shout this from the rooftop, was I really kind of answered something on the order of, gosh, I really appreciate that you're concerned about my kids, with a period. And
Right.
I think it was something that Janine said earlier, like, you know, sometimes when we start talking a lot, we dig a hole for ourselves. And you don't have to say anything really more than that, or in your own, you know, your own language, your own words. But, you know, just you're direct, but not inappropriately direct.
That's fair. Anything to add?
The only thing I would add is that I came up with a pat statement because I didn't want to have to think or be taken aback. My pat statement, and I didn't feel great for having to say it. My pat statement was, yeah, they're getting adjusted to living in Israel, period.
Thanks. Okay. The last thing that I'll leave you with, and Mom, you kind of brought this up. So I remember every time something wouldn't work for me, what I didn't like was that look you would give me. And it was like, I knew you weren't trying to do it, but it was like I pity you, which maybe isn't what you were thinking, but it's how I took it. And I just, it didn't make me feel better because I felt like I was disappointing you, right? So I'm a people pleaser. I was disappointing you. My body wasn't working the way it was supposed to be working. So how do you deal with, that's how I felt it on my end, but how do you deal with grief on your end? Because, you know, you also wanted to be a doting, I'm the oldest kid, you wanted to be a grandparent, you were meant to be that, and I wasn't able to do that for you right away. So how did you deal with your own feelings?
I thought a lot about this. And first of all, the intended grandparents really need time to grieve themselves. And when I was doing those looks, it was actually, I remember this, it was just trying to convey to you how much I feel, etc. And that's how it came out. And I totally understand how you perceived it. And you know what? If you're not succeeding or there's a loss, grandparents also have to grieve for what's lost, what has not happened, as well as maintaining a balance for their children. And this is something else I never discussed with you. I worried that there had been something wrong with my body that came to pass on to you, although it may not have been the same thing. It wasn't the same thing. And that was very, very difficult also. And the fertility buddy thing that you have with grandparents, working with potential grandparents, that when I had a buddy, it taught me a lot about this. So I think that grandparenting is also going through grief. They're going through grief.
Yeah, I mean, for me, I would say my husband probably was my best sounding board. I mean, we would talk about it together. You know, there was, I believe, one time when I was actually with my daughter when she found out that a procedure hadn't worked because she's in New York. I wasn't with her all the time. And, you know, for me, it was about supporting her. You know, I had those same kinds of feelings about, oh my God, what did I do wrong when I was pregnant with her that, you know, because she had unfortunately had so many issues going on for her that caused her infertility. And so those thoughts definitely went through my head. But I mean, again, it was, I mean, so much of my focus was just on her because I wanted this for her so badly. It really, for me, it wasn't about me. I don't know that I felt that much grief. Sorry, my dog's barking in the background. You know, it was really, I just wanted it for her because I knew how badly she wanted it.
I think that the component that I felt is because of my loss, that I was able to, I transferred that onto Ilana. Yeah.
All right. Well,
Can I say
you.
one cute thing about your kids?
Oh God.
The best thing Abby Dunn ever did. We have an 8-year-old and a just about 7 now. About a year ago, because they came from the same batch, is that another word, of fertilized eggs. So when people said, are you twins? Because they really look alike. The younger one says, we're twins, but I was frozen. So, I mean, the kids
we
even
always
know
ask
what's
him.
going on.
Yeah, we always ask him, are you cold? Are you cold? Because he was a freezer.
Because he was frozen.
Thank you very much. Hopefully this was informative. If anybody out there is interested in having a intended grandparent fertility buddy while you're going through this journey with your child or your child-in-law, we're happy to help you. You can follow us on jewishfertilityfoundation.org and Jewish Fertility Foundation on all social media. Thank you, Marlene. Thank you, Janine. I appreciate it, and have a great rest of your day.
You as well. Thank you.